Hi, everyone. Welcome to another episode, part two of 50 Shades of Over 50 with Dr. Kirstie Cunningham. Hello.
Hello, thank you for having me again.
Yes. All right. So, we're going to talk about something that probably women don't want to talk about, but really do want to talk about. So, they talk about it amongst their friends behind closed doors, and it's about orgasms. And so, Dr. Kirstie Cunningham, tell us about the solution that they have to help women have orgasms.
There is something called an O shot, right? An O shot, and it's basically PRP. What PRP stands for is platelet rich plasma.
Hmm.
We take advantage of the patient's own regenerative properties. It's very natural.
Hmm.
We draw one tube of blood from the patient, we spin it down, we get the patient's plasma off of there, and we inject it in a certain little spot in the anterior vagina and a certain little spot in the clitoris.
Okay. Does it hurt? You don't have to answer that question
Let me
because I
tell
have
you,
a low tolerance for pain. So I'm just
let me
asking
tell
for
you,
my
you,
audience, asking for a friend.
I know you barely feel anything because the numbing medicine we use is very
Okay.
potent. And we put the numbing medicine on the anterior vagina and also on the clitoris. And then
I
I
see.
use a little lidocaine at the clitoris.
Yeah.
You barely feel the tiniest little prick at the clitoris. And I
Wow.
can say I've done it on patients and I've done it on myself, and I can say for a fact you barely feel it.
Okay. So, oh, wow. I'm just like, okay. So you don't feel the pain. Okay. Because that for me, pain is like, ah, okay.
Yeah.
Interesting. And that's it. So you just do those two and that's it.
That's it. And it lasts for a year because women don't realize they're not having orgasms and they're embarrassed to talk about it with their doctor or with their
True.
friends, their
True.
girlfriends or whatever.
Yeah.
It is very common actually with women. And some of it has to do with a woman's anatomy. When you think
Hmm.
about it, the
Yes.
clitoris, where the clitoris is, and it can be a good 3 centimeters from the vaginal opening,
Mm.
anywhere from 2 to 3 centimeters. And the clitoral hood in women can be smaller or larger, and it
Mm.
just really depends on your anatomy,
Correct.
whether you're going to get that sensation.
Yeah.
Yeah, so
Wow.
it helps.
So what is the effectiveness? Like 90%, 95? I mean,
For orgasm, it's about 80,
hmm
85%,
hmm
but it's even more effective for relieving stress incontinence. And stress incontinence is when
Oh
you have that
yeah.
urine leakage, when you cough or sneeze or laugh,
Laugh.
and you feel a cough or a sneeze coming on and you cross your legs.
Yeah, because you're like, ah,
Right, because you don't want, yeah.
yeah.
So, yeah, it's about 90% effective for
Wow.
stress incontinence.
So that's
One shot.
interesting because I know that is an issue. I mean, I even have friends who talk about it all the time. They're like, Clavi, do not make me laugh because I'm gonna, there's gonna be leakage. And so but that's more, is that more of a menopausal symptom? Is that one of them? Or is just
It
what is
is
it?
it is one of the menopausal symptoms. It is because
Hmm.
you are losing your estradiol, and as you do that, your tissue, it changes the tissue down there,
Mm,
and you don't have the tone that you used to have. Everything changes, but it's also
mm.
very common in women that have had children,
Oh, vaginal. Okay.
vaginal deliveries. So age, vaginal deliveries, all of that affects the area down
Mm,
there. So
wow. Interesting. And
yeah,
the O shot, is it for anyone, any female? Is
anything,
there an age? Yeah. So
there's
it's not
no
like
age
older
limit.
women. It doesn't. Wow.
No, there's no age limit.
And how long does it last
It
if you keep
lasts
it?
about a year, actually. Yeah. So I tell patients that you usually don't see an effect until about 3 weeks,
Mm-hmm.
because it takes that long for the growth factors to come into the area. Because,
Mm-hmm.
like I was saying, it's a natural therapy. We inject the patient's platelets
Mm-hmm.
back into that spot. It brings growth factors into the area. It brings and you form new vessels, and that's what
Mm-hmm.
heals the tissue. So
Mm-hmm.
it takes about 3 weeks for that to begin,
Yeah.
but you get the maximum effect around 3 months.
Mm.
So, but I'm having patients tell me like, oh, I felt better 2 weeks, 90%
Wow.
of the urine leakage was gone.
Yeah.
So, yeah.
That's interesting. I didn't even know anything like that existed.
It's awesome. It's awesome.
Wow. And is there anyone that isn't a candidate for this? Like,
No, well, I would say if you've had surgery before and you have mesh and all of that in place from a previous incontinence surgery,
mhm,
then that deserves an in-office evaluation
mhm,
so we could
okay.
actually sort things out.
Mhm,
But for the most part, you're a candidate if you're having these symptoms.
yeah.
Yeah.
So, in terms of cost, does insurance cover this? Is it out of pocket? How does it work?
Oh, just like those other therapies for women, it's not covered
Nothing is
by
covered, right?
insurance.
I
It's not
know they don't do
covered.
anything. They bring nothing for us.
Nothing, nothing, unfortunately. So no, it is
Yeah.
$1,500
Hmm.
for
Yeah.
that one
For that
year.
one shot per year. Yeah. So you just do it per year. Wow.
Yeah.
And it's just you coming that one time, right? Or is it like numerous visits, like
No,
consult
you're coming
first?
just at one time. And the whole thing takes, I would say, maybe 20 minutes. The
Hmm.
actual procedure takes about 10 minutes, but we
Okay.
have to draw your blood and then we have to take it, centrifuge it down. So that takes
Okay,
another
sure.
5 minutes. And then we come back and then we do the procedure. So the procedure itself is about 10 minutes.
10 minutes.
Yeah.
Wow.
So
That's
I have there's a website if you want. I can,
yes.
okay. So
Please do. Yeah.
okay, so it's www
Hmm.
dot oshotsexy.com, but you have to make
Okay.
sure you put the W's in.
Okay. And I'm going to put the link down. So just in
Okay.
case, but I know some of you want to like learn about it like right now, but I'm going to
Yeah.
put the link down. So once you finish watching this, the links will be down below and you can click on it to get more information. Cause I think this is helpful to women. We need it. I mean, we need to be our own advocates. So,
Right, we do. I mean, it helps to restore confidence. That
yes.
combined with the hormone therapy, I think it's a great combination.
Yeah.
Restores a woman's confidence, help you feel great, you know,
Yeah.
fix
I
your
mean,
relationship.
yeah, I love it. I love it. And I'm definitely going to put the links down below so people can go in and look and see, because I think information like this needs to be shared. Um, I'm big on sharing this type of information so women can know, like, this is available. You can get this.
Yeah, yeah. I think the great thing about it is that it's natural. So you're not it's not even a medication. You're using the woman's own plasma and they're just regenerating themselves.
Wow. So how long has this been around? I've never
It's
heard of
been
it.
around several years, but it's
Okay.
it's it's gaining traction now.
Hmm.
Um, the PRP itself
Hmm.
has been used, I would say, at least for a decade, but
Hmm.
other modalities they've been using it. Um,
Oh, in different
you know,
areas.
right, in different areas. But now, the gynecologists have gotten a hold of it.
And it's out.
Right.
This is
So,
great. I love this. Well, you know what? Thank you so much. Is there anything else that we should know about for women? Since we're here.
yeah, well, I know. I'll just say PRP, just one more thing.
Oh,
PRP, to
please.
show you the
Yes.
power of PRP. PRP has so many uses. It can be used in facelifts,
Mm,
like I was saying, estradiol, when you lose your estradiol, it affects the skin. You get the
yeah.
sagging, you get the
Yeah.
wrinkles,
True.
and so many things. So PRP, you can use it here, and you can do a facelift.
Wow.
There are some studies that have been done where they've been using it for androgenic alopecia. So
Oh,
that's the kind of the
wow.
male pattern hair loss that women get.
Yeah.
And the studies are conflicting. There are some studies that, they had really good results.
Hmm.
So that's another use of it. Another use is, and I'm just talking about uses, I'm not necessarily doing this in my office
Right.
yet,
These are just other, yeah.
but, just to show you how it can be used.
Powerful. Yeah.
Yeah,
Wow. That's
yeah.
cool. That's great.
So
Yay.
yeah,
Good, good, good. All right, ladies, you heard about it. The O shot.
the O shot. And I would say, even if you don't come see me, if you don't feel great, see someone and
Yeah, that's
just be
true.
your own advocate.
I agree. Because I think there are lots of women who are suffering in silence, thinking that there is no solution, there's no help, but there is help available. And so,
Help.
listen, if you're in Atlanta, you need to come see Dr. Cunningham. But if you're not in Atlanta, which some of you are not, do go and speak with your physician. And when you do go there with questions, know what
Right,
you want and ask for what you want when you go there.
right.
Yeah.
Preferably someone that specializes in hormones, preferably
Yes,
bioidentical. Yeah.
exactly. Because, that means they're doing it already in the office. They have the experience with it. So definitely go to someone who has that.
Yes.
So thank you for adding that, because I think that's important, because I know I've spoken with different clients of mine where they've been in situations where their doctors have told them, oh, well, this will pass. And I don't think that's an acceptable response. Like, no, it will not pass. You need a solution,
Getting old. No, no.
you know?
Yes, we're all getting older, but we don't have to feel old.
Yes, exactly. Exactly.
Yes.
Thank you so much.
Welcome.
Thank you so much for all this information. So now you have another decision to make, ladies. So thank you so much. Thank you for listening. And I'll see you guys next week.
Thanks
Take
again for
care.
having me. All
You're
right.
welcome. Bye. If you enjoyed listening to this show, you have to take a look at Flourish, my online global community exclusively for women in their 50s and beyond. We talk about the important issues affecting women in their 50s, 60s, 70s, and beyond in a safe and non-judgmental environment. We also provide the tools and resources to help you create your best life on your own terms. It's never too late and you're not too old. Go to the link below to learn more.